Hi, and welcome to the Melanin Initiative. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking up too much of your time. Today, we'll be talking about Polycystic Ovarian Syndrome, or PCOS. We will define PCOS, talk about the risk factors, symptoms, diagnosis, treatments, complications, and long-term maintenance. If you're new here, welcome to the Melanin Initiative. I'm Alicia, and I co-host the Melanin Initiative alongside Kimberly and Geraldine. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, subscribe so you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. It helps us help you. It also shows YouTube that this content is valuable and helps to make sure YouTube shows our content to those who need to hear it. As a reminder, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988. So, as I previously stated, we're going to be talking about Polycystic Ovarian Syndrome today, ladies. Also known as PCOS, much easier to say. So, as we start any of our episodes, we're going to start with the definition so that we know what we're talking about. So, PCOS is one of the most prevalent endocrine system conditions. And if you remember, the endocrine system deals with your hormones. And it's a condition affecting women of reproductive age and is called Polycystic Ovarian Syndrome. It can also be known as hyperandrogenic anovulation, or HA, or Stein-Leventhal syndrome. But for today, it's PCOS for us, okay? It also describes a condition where at least one ovary has an ovarian volume greater than 10 milliliters and at least one ovary that has an estimated 10 small cysts with diameters ranging from 2 to 9. Also, fun fact, 4 to 10% of reproductive age women are predicted to have PCOS worldwide. So this is more common than you probably think it is. And we probably don't talk about it enough, if we're being quite honest. PCOS can occur at any age, beginning with the menarche, and that's when the majority of instances are identified between the ages of 20 and 30. And then PCOS is a lifelong syndrome that it can first manifest during pregnancy, although traditionally thought to be a disorder only affected by adult women. So, moving on, Kimberly, why don't you tell us about some risk factors associated with PCOS?
I just want to add, so Alicia mentioned that it affects women. This includes, this is if you're born a woman with female body parts. So even if you identify as transgender male, but you haven't had any procedures done to remove your female organs, this still applies to you. And so it's really important that you communicate that to your healthcare provider so we can screen those risk factors, educate you appropriately, and make sure you get the right treatment. And then you mentioned menarche.
Yes.
Which, until recently I was watching some guys who do a podcast, and they were talking about kind of like the period and stuff like that. And so some of the terms, like, I just take for granted.
I was saying, and I was like, I don't know what that means, but
you might not know what it means.
Right.
And when he said it, it was like, man, I just take that for granted that not everybody even knows what that means. Especially because we use the word period all the time.
Yeah.
So menarche is that first
period, menstrual period.
Yeah, first. So now I'm going to use other terms, right?
Cycle.
So the first time a young girl has her period or has some bleeding coming from her body. So let's get into risk factors. So like most things we talk about, lifestyle and what you eat is going to play a huge role. Environmental pollutants or things in the air. It could be things in the air as well as things from the car or places where you work, like asbestos, so exposure to certain kind of toxins, which you might not think about in the moment, but certainly if you're having symptoms and your provider's asking you certain questions, this is like a good time to kind of think about what kind of jobs you've had and what you may have been exposed to. Mm-hmm. And typically, even in our roles, all of our orientations usually include some kind of like risk modules, right? And it goes over certain things that you might be exposed to, and that's why they're going over it. One, so you know how to protect yourself, and two, later down the line, you'll be like, oh, you know what? Maybe that's something I need to look into more.
Right.
And it could be, the thing is, sometimes this stuff doesn't even appear for decades, and you might forget you did that job for 6 months, right? Genetics, right? Something that's not in your control. Gut dysbiosis can be both a contributing factor as well as worsen the disease. So gut, we're talking about your bowels, your GI, or your intestines, and dysbiosis refers to an imbalance of what we call good and bad bacteria. We know that we need the good bacteria. They're there all the time doing stuff for us that we're not even aware of, and that there can be certain things that happen internally or externally to the body that can disrupt that balance. Neuroendocrine alterations, so the signals that your brain might send to your organs that release hormones, if there is some interruption in that process, that can increase your risk. And you wouldn't know that, but certainly once you start getting evaluated, that can be something that gets uncovered. Obesity is a risk factor that puts people with female organs at risk. And these risk factors can increase the chance of having elevated blood insulin levels, irregular menstrual or periods, hormone imbalances, like we talked about before. The key risk factors are going to be those genetics. So that's why it's so important we share with our family if we know, right? Yeah. We know in our community sometimes we don't know, and that's kind of a big problem that we have. And then the environment plays a role, which again could be outside of your control, especially if you're a young person. This could be where you live, where you eat, how much money you make, and the pollutants that we talked about. So a big one is going to be an excess in androgen hormones, which is another word for male hormones. And this is seen in up to 80% of girls and women who are diagnosed with PCOS. It's a key problem in the disorder, and it likely comes from the ovaries in most patients. Insulin resistance or elevated insulin levels, which is what helps control your blood sugar levels, may worsen this excess male hormone in your body. Abnormalities in the brain, like I mentioned, or your pituitary gland, which is kind of responsible for your release of hormones throughout the body. That can play a huge role. And a lot of patients actually tend to be very aware of their pituitary history. They will know, and which is kind of impressive. And then other hormones from the ovary or fat tissue might be involved. Increased risk for endometrial cancer, which is the lining of the uterus, and this can also increase your risk for diabetes.
That's what I was going to say. When we talk about the androgen excess, that's like one of those key markers that, it's kind of like a telltale sign. So why don't we talk about some symptoms, Geraldine?
All right. So diving right into symptoms. So one of the main symptoms is irregular menstrual periods. And also polycystic ovaries, meaning they're, like as Alicia mentioned earlier in our intro, that there are cysts on the ovaries. However, despite the name Polycystic Ovarian Syndrome, not all individuals necessarily have cysts on their ovaries. You can still have PCOS without having cysts. Infertility is another symptom. So if you are a woman that's trying to get pregnant and you're noticing that you are unable to, and you also have some of these other symptoms, this is definitely something that you should bring up to your gynecologist. or primary care. Because some primary cares also do both. So both, and then if they can't assist you, obviously they'll refer you to specialists. And then another symptom, as Kimberly mentioned earlier, is insulin resistance and diabetes. Weight gain and obesity is a huge one as well. Cardiovascular problems such as high blood pressure, high cholesterol levels, and heart disease. And then hirsutism is another symptom, which is hair growth in areas like facial hair growth in women. Acne is another big one, and then those with PCOS also have a higher prevalence of sleep apnea, which we did have an episode about sleep apnea back in, what was that, season 2?
Very popular episode.
Yeah.
And we'll put the link for that in the description box.
So those are some of the symptoms related to PCOS. So some people may have multiple symptoms all at once, or some people may just have one, but it's definitely worth getting checked out by your PCP or your gynecologist to make sure that you are well taken care of when it comes as it relates to this. As far as diagnosis, so the diagnosis of PCOS typically involves a combination of collecting medical history from you, as well as collecting like your symptoms. Your doctor or provider will do a physical examination as well as lab tests to determine, a lot of times it's to rule other things out. And they also may perform a pelvic exam to check for signs of PCOS, such as the enlarged ovaries or having cysts on your ovaries.
We've mentioned ovaries a few times. Did we talk about what it does? The ovaries?
No.
Yeah, I don't think we did.
didn't.
And does everyone have ovaries? No. Just found in the female body.
Yep.
But yeah, so the ovaries, you have 2 of them, one on the left, one on the right, and it's throughout the month, the egg, right, evolves and matures so that one is released every 28 days.
28 days, yeah.
And then in the event that you're going to get pregnant, it gets released, planted into the uterus, and if there's no sperm to meet it, no pregnancy occurs, then that shedding of the lining occurs. That shedding causes bleeding. That bleeding is what we call the period, the cycle, the menses.
Yeah, perfect. Thank you for that explanation, because not everyone knows about ovaries or who has them.
Or what's causing the bleeding, right?
Oh, that's true. That's
and,
true.
And isn't it something like it's really like a teaspoon or a tablespoon or something? It's like really.
Yeah, it's very small. Like the amount that the menstrual period for the 7 days.
But the experience, right? I'm a skeptic.
Right. I don't think it's that small. I'm just saying. But hey, another thing is that your provider may order like blood tests to measure your hormone levels, to rule out other conditions as well.
And I'm so glad you brought the blood test, because one thing I want us to do, because Alicia loves to promote smoking cessation or stopping smoking, and so much of the time we're learning as we do the show, right? And as our clinical practice continues to grow, we spend so much time talking about not smoking for lung cancer, that we forget about the rest of the body. And we're not going to do the whole body today, but since she mentioned taking your blood, and we mentioned taking your blood a lot of episodes, when you smoke, it constricts your blood vessels, and it makes it that much harder to get blood. And many of you watching or listening have experienced that then it requires us to do more and more sticks, which none of us want to do. You don't want it, and we don't like it. But smoking is one of those things that will put you in that position to make it not easy to get your blood, or what we call a hard stick. So if you don't think you're going to get lung cancer, and that's not enough to convince you to stop, but you hate needles, then maybe you should reconsider smoking, and that includes vaping.
Yep.
Sounds like we need to have an episode on blood vessels, what they do, and how to keep that blood flowing. Yes.
Well, we actually are going to have a little bit, because we have Dr. Yvette Conyers coming on. She's going to do amputation prevention. And in that episode, we do get a little bit into the health of your blood vessels and as it relates to smoking. But we do need to do a dedicated episode on smoking and vaping.
Yes. Stay
tuned for that.
All right. So just another thing to mention, the exact cause of PCOS is not fully understood. So a lot of people are always like, okay, how do you get this? A lot of times when there are diseases or just, diseases or ailments that are out there, you're always like, okay, is there something that I could have done to prevent it from occurring? Sometimes it just happens, unfortunately. But like I said, it's not typically the diagnosis of PCOS is not typically is not fully understood, but it is believed to involve a combination of genetic and environmental factors, as we previously mentioned. There is no cure for PCOS, but various treatments are available to help manage your symptoms and reduce complications that can arise.
And I think it's one of those diagnoses that gets misdiagnosed for a long time.
Yeah.
And that just further makes people more frustrated, right? Especially if you're dealing with like the physical symptoms and having to, some things we can hide and struggle in silence, but some things we can't, especially like the hair in the face growth, and the
acne,
you know? The acne, and the appearance, you know. I
think that goes back to some of the challenges that women and especially Black women face in healthcare. So,
a great topic.
Yes.
So we talk about treatment, right? We look at those risk factors again, being genetics and your environment, but also what's within our control, right? And that's what we're eating. And so some things I don't know if we've gone a lot into prebiotics through this show, but certainly it's becoming more of a popular topic. Your prebiotics, your probiotics, symbiotics, and my favorite, the fecal transplant. So your prebiotics as well as the probiotics. Maybe we'll see how our graphics are, but we might be able to put up a little something here. So if that's occurring, if not, just imagine, or we'll put some links in the description box, certainly. But this can be a combination of food items, especially anything in your produce section, things like yogurt, and then of course supplements. There's a range of supplements. I'm not even going to pretend to be an expert. The experts usually practice in integrative medicine, but you can find supplements over the counter as well as that require refrigeration, from a low price point to a high price point. And basically we're doing different things. We're either going to be feeding the good bacteria in your gut or replacing it. So as I mentioned earlier, we have good bacteria in our gut that's fighting all the time, right? Because things that we're eating come from the ground, they come from all over, and so there might be germs or things on there that our body is not useful to our body, but the bacteria in our gut eat it away and we never know. Or maybe we get a little gas or bloating, but nothing happens. It doesn't slow us down. But other times maybe we get sicknesses, or we take something like antibiotics, which antibiotics don't know what's good or bad, so it just kills everything. And it can take 3 months or longer to restore that good gut bacteria. So in the meantime, you might have something like a diarrhea, put you at risk for things like C. diff or Clostridium difficile, which causes diarrhea. It's like an infection of your gut. So anytime you're on antibiotics, at least I recommend to my patients to start eating that yogurt that's high in that good bacteria, and taking those pre and post probiotics, which I do on a daily basis.
I would also like to mention, though, because you said don't take them at the same time. So that's what I always have to tell because I always tell my patients, make sure they're taking the probiotics when they're on their antibiotics, but you can cancel them. If you take them together, one will cancel the other out. So it's best to separate them by like 2 hours, at least 2 hours, if you are taking it.
Thank you so much for mentioning that. Medications that can cause ovulation, again, because this is all really like a hormone imbalance, as well as birth control, which also addresses hormone imbalance. And then there's certain diabetic medications that can be used to manage the symptoms.
So thanks for sharing, Kimberly. And as with any health condition, there are some complications that could arise. So women with PCOS are more likely to develop certain serious health conditions. We've already named a few. We've actually discussed these pretty in detail here on the Melanin Initiative, but some of these include type 2 diabetes, high blood pressure, problems with the heart and blood vessels, and uterine cancer. And women with PCOS often have problems with their ability to get pregnant, which is also known as fertility.
Oh, infertility, right?
Yeah, infertility.
Infertility, yes.
So for your long-term maintenance, some women or people who identify as female and have those female organs struggle with the physical symptoms that we just described, right? The weight gain, which is for us very distinct, right? It's typically going to be like kind of top heavy and sometimes more of a square face, neck lining or chin profile. Excess hair growth in areas that typically you're not expecting, and it's really hard to control, right? Because we all get a little pluck here, right? But this is like that 5 o'clock shadow every day. Right? Mm-hmm. And especially when they're a patient and that's not really a top priority for us to care for, it really stands out, you know. And acne. So we can use cosmetic treatments for that, electrolysis, laser hair removal, may help you feel better about your appearance, make you boost your confidence. So you can talk with your healthcare provider, both your primary care, but also when you go into like wellness centers and med spas, you're really going to see a lot of these treatment options, and they're going to be more familiar with it because they specialize in that, so they're not spending their day doing all the things we talk about in primary care, like diabetes, weight management, smoking cessation. Well, they do weight loss, but like all the other things, they're only focusing on what we kind of call our wellness space, and so they're going to really be your experts in addition to integrative medicine and endocrinology when it comes to like hormone and weight management and being able to see you on a more frequent basis. Sometimes it's out of pocket and sometimes you get some insurance coverage with that. So endocrinology, cardiology because of the stress on the heart, your gynecologist because, again, another hormone specialist, integrative medicine, and dermatology could be part of your treatment, your healthcare team. Yeah, I think we covered those people because I mentioned. So anything else anyone want to add before we do our recap?
No, I don't think we covered quite a bit.
Yeah, so today, everyone, we talked about PCOS, Polycystic Ovarian Syndrome. We talked about what the ovaries are and where you can find them, what they do. The risk factors, with the two primary ones being environment and genetics, which are not in our control most of the time. So all of our emphasis is going to have to be on our diet. And sharing our health information, right, so that the next person will know that their risk is much greater. We talked about symptom management, particularly because there is no cure for PCOS, how it's diagnosed, which includes both physical exam as well as blood work. And it's probably going to take more than a few visits to get to that diagnosis, unfortunately. Treatment options, which includes a variety of specialists from endocrine, dermatology, primary care, integrative, and gynecology. Some of the complications associated with the disease: increased risk for weight gain, diabetes, heart disease, and then long-term maintenance options. You can always email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, please make sure you subscribe. You can hit that subscribe button. You can hit the notification bell. So every time that you're logged into YouTube and you come on the app or on your TV, will either appear on your homepage or under the subscription tab, and you'll be notified every time we release a new episode. If you subscribe on the podcast, particularly Apple and Spotify, we ask that you leave a comment, rate us, and that just helps us get a higher ranking. When people put in the topics that we discuss, we'll appear higher in the search, and the people who are just like you that need to hear this information, the algorithm will make sure that it presents to them. You can find us on all the social media platforms, and all those links will be in the description box, as well as a list of resources for any of the topics that we brought up today. We release new shows weekly on TMI Tuesdays at 10 like this, that are what we consider health literacy topics. So just like that basic understanding of your body. And then our professional series, where we promote professions in healthcare, those will be airing on Sundays at noon. This season, we're also rolling out our Patreon, which is an opportunity for you to financially support initiatives that we have. Our first one in the community is going to be getting enough funding to purchase at least 25 blood pressure monitors, so we can go into the schools, teach students and the faculty about the importance of primary care, their role in health promotion and disease prevention, with emphasis on learning how to take a blood pressure, why you should take it, why it's important, symptoms to look out for, and take that information to their family and to the broader community at large. We're also going to be opening up our merch store. By now you've seen our new logo, as well as actually at this point, I don't think you've seen our new t-shirts, but if you follow us on social media, you'll see the release of that logo, and our merch store will be available, if not now, soon, for you to purchase. That's all I have. We thank you so much for watching, and we'll see you next time.
Bye.